the Mental Health Authority. So it makes it a little bit easier, but sometimes I kind of go back and say, is it Detroit, Wayne County, community? And of course, you've heard me give accolades, and they are certainly due to the role of the Early Investment Corporation, as well as the Great Start Collaborative Wayne. And also, please understand that the American Academy of Pediatrics at that national level has been the leader amongst others, but particularly around this issue of children's medical home, and which is why we're so pleased that Dr. Charlie Barone, the Director for Pediatrics at Henry Ford, and previously the President of the chapter, is here. And I can also add that Denise Sloan, the Executive Director, and the current President, Dr. Lawrence Reynolds, send their greetings. The Michigan Department of Community Health, well, the funders, people who help drive policy. Alethea Carr, who is the Director for Children and Women's Services, says she is here in spirit, as she has been with us consistently in this journey. And I also want to let you know, obviously, that while we're talking about education, we have to have the involvement of the intermediate school district, but really important, one of the things we're forgetting is that when we think about where our children are, particularly with adolescent care, we know that many of them are not getting in to see their primary care physicians. They're going to the place and space that they can get some immediate responses to, and that's in their school-based health center. And so while school-based health centers right now are not medical homes, we are excited to have the involvement of Shami as we work with those centers. So how can we improve the quality of what they're doing and assist to have stronger linkages back to the primary care providers? So just want to let you know that all of you strategic partners are appreciated deeply, and we hope that you know how happy we are to have you at the table, because we've got a lot of work to do ahead. So with that, I'd like to move directly into our program. We have a few other people that have joined us. I'm going to ask, we have a representative. We're really pleased some of our legislators are here. So I'm going to ask a representative from Senator Hanson Clark's office to at least stand. No, yes, absolutely. And if we could all, on behalf of all of our children, thank the good work that he is doing on our behalf. Carlton Merritt actually came to a Great Start parent event, and we're really pleased that he got excited about the work that we're doing, and we look forward to having conversations not only particularly with Senator Clark, but that all of us can begin to wrap and have conversations with our legislators. Let's then move into our program. It's pretty full. We have important voices to hear from. And so I have asked, as we look at your agenda, and I hope that everyone has one, we've asked Chris, who is our fiduciary for WCHAP, for that wonderful and generous award, that investment from the President Foundation. As an entrepreneur myself, my husband and I have had many businesses, we look at grants as an investment. And we're stewards of this. And we are excited to be stewards of this. And so part of that stewardship is to have a quality fiduciary that you can have confidence in and know is going to walk with you on this journey to have the resources to do this work. So with that, I'd like to have Chris Allen, the CEO of Detroit Health Authority, come forward, and he is going to introduce our next speaker.
And I want to thank all of you in the audience that are providers of care for children or organizations that help children. Thank you for what you do, because it is so needed in this market. I think the theme today for this launch, helping our children bloom and families flourish, that's what it's all about. And Jimena made a comment, was if not us, then who? And the people in this room can in fact make a difference in this community, as you have done for many, many years. But I heard one other thing, system thinking or systemness. The ability to align resource to have a greater impact on the services that we do provide. And I think that's happening right now. I am so happy that President Obama and the Congress passed this health care reform. Yes. Because it's going to create a wonderful opportunity. If there was a time for change, it's right now in terms of improvement and health outcomes for children, for families, and for the population in a whole. So we are very pleased about the strategic partnership between the Health Authority and WCHAP and our efforts to extend and expand access to care for services for children and families. We believe that everyone, every child, deserves a medical home in which primary care provider addresses the child's holistic approach, including the well-being, including physical and behavioral health. A year ago, I sat down in Vita Sharp's office, the Executive Director of Wayne County Community Mental Health, and we talked about creating an integrated health council. And within the last 2 weeks, we just finished a year-long effort that pulls mental health and physical health in the same location in community settings where we can provide better care to families and children. So I'm really excited about that, Vita, in terms of where that's going to go. And I look in the audience and I see Laura Trudeau. And years ago, we partnered on an effort around maternal and child health. And so there are a lot of great people in the audience that are doing good things. And this systemness, this kind of system thinking is where we are right now at the Health Authority. How do we align the right resource to get the right outcomes? When I was, I won't tell you how long I've been in this business, but some of the issues that we had before was say, well, if I was in that position, I would have done this, so we wouldn't have these issues. And so on our watch, on our collective watch, what difference are we making in the lives of people in our community? We also believe that every child deserves access to health and wellness. Our board approved the Health Authority going into the wellness business. Rather than talking about sickness, let's get into wellness. How do we work with families to create healthy communities? And it all starts with a healthy child. WCHAP's emphasis on obesity and other chronic diseases, integrated health, and maternal and child health perfectly aligns with our philosophy at the Health Authority. We are extremely pleased to have Dr. Holtrip and Jametta Lilly as our leadership in WCHAP. Now, Dr. Holtrip and I have had many healthy discussions. She's passionate about her work, and so am I. So you can imagine. We have an initiative at the Health Authority that we believe that before a child goes back to school, they should have a comprehensive physical. And we also believe that while we're doing that physical, we need to find out, do you have health insurance? And we have a web-based benefit calculator that we can enroll families and children in 15 or 20 minutes on the spot. We also encourage them, do you have a medical home? And if you don't, how can we help you get one? So Dr. Holtrip and I are on the same page on that issue. Again, we are excited about being a part of this new launch. And we hope and we pray that within the next 3 years, the data will suggest that because of partnerships like ours, we are making a difference. So we're real proud and privileged to be a part of it, and thank you for allowing us to be here today and be a part of your program. Now, I was asked to introduce our next speaker, and it's Judy Samuelson, the founding Chief Executive Officer of the Early Childhood Investment Corporation. Ms. Samuelson is a former journalist and served 16 years as Director and Vice President of Communication for the Charles Stewart Mott Foundation. Ms. Samuelson also served as the founding Executive Director of the National After School Alliance, a public awareness and advocacy organization for after-school programs. The Early Childhood Investment Corporation is a unique, statewide public and nonprofit corporation. ECIC was formed to ensure that public and private state investment in early childhood is maximized to ensure that all children arrive in kindergarten ready for school and for life success. And with that, I'd like to introduce Ms. Samuelson.
Well, I have to tell you, I think this is a pretty wonderful day for young children in Wayne County. You all need to give yourselves a round of applause for even being in this room today. I really believe that with this announcement today, one more stake in the ground has been driven for Michigan youngest learners by the people who best understand the critical importance of those youngest years of life. But for the unrelenting intestinal fortitude of Jametta and Dr. Holtrip and Deb and Tony Hartkey and the Great Start Collaborative and its Committee on Pediatric and Family Health, and Chris and the Wayne County Health Authority, I'm not sure we'd be standing here today. And I think that it really bears witness, this day really bears witness to the incredible leadership that's been provided in terms of medical home by Kent County and Kent CHAP. And I would be terribly remiss if I didn't personally call out Dr. Tom Peterson and Maureen Kirkwood for all the things that they've done to give us the inspiration, the model, and most importantly, the impossible to argue with results. Thank you both for giving so much of your time to help get Wayne launched. And I hope you'll convey our great thanks to Dr. Peterson as well. And also Susan Broman, who I am blessed to have as a board member at ECIC, and Milt Rohr, who have spent so much time making the business and the foundational case for this investment. So now we just have to, we have so many wonderful champions, now we have to get some of the other people on the board. I will leave it to others to thank still others who were instrumental in bringing us to this day. And I have to say that I think Jack, my good friend Jack, and Chris and Jametta have all really talked about the fundamental elements of why this work is so important and why it is such a tipping point, really, to be in this community for this announcement today. I'm really excited to hear people talk about systems change, you know? I mean, it's like, wow, people are really waking up to the systems change thing, you know? When the Early Childhood Investment Corporation was created to sort of foster that in communities around the state, it was surprising how quickly local communities took to it and were willing to get in a room and talk about where children are and what their issues are and what assets the community has to bring to the table, and start doing the incredibly hard work of making systems change. This room is an amazing testament to that and to what's been going on generally in terms of systems change around Michigan. It's funny to me, knowing that in some cases in the Michigan legislature, we still have to explain that this work is value added, and that they can so readily chop funding away from the institutions that are in the business of trying to make our resources go further through the simple act of bringing people together in communities to say, hey, how can we make our work go further for young children? I really love the notion of medical home. I absolutely love it. You know, home is supposed to be where we're known and we're loved and we're respected and we're safe. It's not always true, but that's the idea. And what is really appealing to me about medical home is that it's going to be that place where children and their families will be known and remembered, and that their cultural traditions and their ideas will be respected, and where they'll get the help that they need to coordinate care and navigate this ungodly system we have in Michigan of so many things in so many places. Something that we are actually on a road to changing in Michigan, thanks to the governor's recent announcement about creating an Office of Great Start. I know that Jack has already touched on this, and Jametta touched on this, and Chris touched on it. Now I'm going to do it too. So hopefully you'll take away from this the fact that we all think it is really critically important. The Michigan legislature is still in this place where it's trying to figure out how to make tough choices in tough economic times, and trying to decide what are the essential programs